Hi, this is Dr. Wells with Wells Medicine. So, how does depression show up on imaging? A lot of medical providers want to see changes on some sort of test that they can evaluate. So, a blood test with differences in numbers, an imaging test with changes in what you're seeing on that imaging. EKG, where you're seeing changes in the waveform of the heart. So how does depression show up in imaging changes? So we can do something called a PET scan, which is a very fancy CT where you're given a dye where it's basically x-rays in very, very thin slices. And with a PET scan, you give a dye that causes, or that's picked up when there are different metabolisms in different areas of the cells. So you can see which cells are more active, which cells are less active. And when you do a PET scan on someone with depression, there are changes in the images. So you can see lower levels of metabolism in some cells. You can see changing areas of which cells are more active than in a neurotypical brain. And you can see those changing back to closer to the images of a neurotypical brain after things like ketamine, TMS. And so we have data showing that ketamine and TMS can change those PET scan images back to closer to normal images. And then we also are looking right now at EEG, which is electroencephalograms. So the electricity flowing through our brains makes different patterns. So EEG, you measure for seizure activity, you measure for ADHD, you can measure it for the slowing down that you'll see typically in depression. And so we can see those EEG changes, and you can see those starting to normalize as well after treatment for TMS or ketamine with kind of the normalization of EEGs during those treatments back to closer to what patients who don't have depression would show. And we're currently doing a study right now with Texas A&M University and NIH funding on what particular EEG changes show us that someone would be a good candidate for responsiveness of treatment with ketamine. So lots of exciting work to be done on this, but there are some test result changes you can see happening in the brains that you can see on EEGs and on PET scans normalize through treatment with TMS and ketamine.